tell me a little bit about how you got involved with home care?
So when I got it through another student actually. She was a past ACPHS student, and through one of she's not like she's underneath the program director, but she works almost does the same amount of work. She sends out emails for different job opportunities, and I was looking for a job within healthcare that I could get hours for PA school. So I got an email on my school email, and it was talking about this home care job, and it was really close, and they had hours that I could do with my schedules. So I ended up getting on a phone call with this past ACPHS student, and she was telling me about it and like how long she's worked for the woman. Her mother worked for her, her sister worked for her. Um, so then I ended up getting the job through that, and it was pretty smooth thing. It was cool.
Can you tell me about the work you're doing for this particular patient?
So I'm doing activities of like daily living. So when I get there, I like set out, like she takes specific supplements and she takes specific medicines. So I set those out. I get her out of bed. I bring her um daily living activities, bathroom, take her to the shower, pick out her clothes with her. Basically, I cook for her, I clean for her, I do her laundry. I basically help her achieve living, and then she's quite independent on her own, so like I don't have to bathe her. I don't have to like help her use the bathroom. It's more just transporting her, mobility, and activities that she can't do within her wheelchair or with her specific disability.
What do you find most rewarding about working for this in home care and for this patient specifically?
um I think it's just like helping her like live her life in a way. Like I'm like not so much helping, but like serving her and helping her like achieve like an independence that if she per se like lived in a home or um like didn't have the ability to be like, I'm gonna go do this now, and if you could just like do these tasks that I couldn't do, like I really appreciate that. um and like getting to know her as well, because she's been in the Albany area her entire life, so I like know so much more about this area than I ever like thought I would, or would take years for me to know about. And just spending time with her and like getting to know her and seeing her live her life.
You see this job as influencing your career path going forward?
Oh, absolutely. So I don't know if I'm gonna stay within health, like home health, for my entire career. I think like I might like hop in and out of it, but I do want to go to PA school and like go um within like the OBGYN neonatal maternal route, and then also go into policy. But I think it'll definitely like impact the way that like I talk to my patients and how I treat them and how like I work with them. And especially in policy, there's so many things that go on within politics and legislature that impacts like her life and like the care that she can receive, and like the ability for her to like receive care and for the ability for me to provide her care. um Definitely, like I couldn't put into words like how much like it's going to impact that specific portion.
If a fellow student asked you about being a home health aide at this point in their career, where they're in life, what would you tell them?
I think it's a really rewarding job. It is definitely hard because like you are essentially like an extension of another person, like trying to help them, but it is so rewarding, and you really get to like know this person and spend like countless hours. Like I've only been working with her for since April, but I feel like I know her so well and I know so much like about her. It truly is super rewarding, and it is great experience where you're not like, in like working in a hospital or like getting your first job in healthcare in a hospital or in like a super busy clinic. You get like that one-on-one experience, and like you slowly get to get your feel of things instead of getting thrown like to the wolves that you would in other like first entrance jobs. Not that this job isn't hard, but it is more personal and like more can I don't know, relaxed, but not.
Has she ever said anything to you that has made you think I was meant to do this or anything along those lines or anything that's really touched you?
Um, she definitely has like shown her appreciation for all of us. Like we like are a team, and like we're like she calls us like her, I can't say her last name, but like we're team her last name, because like we are, and like we all keep in touch with each other, like we all like work with each other, and like how much she appreciates like what we do for her and like all the little things that we do, um like that I'm so young when I'm like getting this job, even though like I'm only like 21, but I was 20 when I started, and she was just like, I can't remember a specific thing that she said, but I've gotten like a lot of compliments from her and like how like good I am that she didn't really expect like someone so young who like hasn't worked within a hospital is so good at like helping her and like taking care of her.
Sounds like you found like a very rewarding part-time job, which is great.
Yeah, it's definitely really fun. It's fun, honestly. Like it's like spending time with like family at this point, like getting to know her and like spending time with her. It's not so much of like me going in and taking taking care of her needs and then leaving. It's like I'm spending time with her even between like all the stuff that I do.
You've got a relationship. It's more than just a caretaker situation.
Hmm.